Welcome to Med Health Channel. Here we upload videos to give you a helping hand in understanding medicine and health. We hope to give you tips to understand medicine and achieve your health goals. If you are new here, do not forget to subscribe to our channel for more videos about how to live a healthy life. In the lesson today, we are going to learn the difference between Cialis and Viagra. Let's start. What exactly is Viagra? Viagra is a brand-name drug for the treatment of erectile dysfunction, ED. It includes the active component sildenafil and was initially developed by Pfizer as a therapy for angina in the 1980s and 1990s, a type of chest pain caused by certain heart conditions. What exactly is Cialis? Cialis is also an FDA-approved brand-name prescription drug for treating erectile dysfunction, ED. It was initially created by Lilly Icos, a business that is now owned by Eli Lilly and Company and includes the active component tadalafil. Viagra or Cialis, which lasts longer? Although Cialis and Viagra operate similarly to increase blood flow to the penis and cure erectile dysfunction, there is a significant variation in the length of time each medicine remains active in the body. Cialis is a long-lasting treatment for erectile dysfunction. Because it may last so long, it is frequently referred to as the weekend pill for treating erectile dysfunction. A standard dose of Cialis or generic tadalafil will provide roughly 36 hours of relief from erectile dysfunction. This long-lasting impact makes Cialis or generic tadalafil an ideal option for men with erectile dysfunction who are unsure of when they will engage in sexual activity with their partner. Whether you're going away for the weekend or just want to be prepared for an unplanned sexual encounter, a single dose of Cialis is typically plenty. Viagra, on the other hand, is a drug for erectile dysfunction with a shorter duration of action. A standard dose of Viagra or generic sildenafil will offer around 4 hours of relief from erectile dysfunction. This implies that Viagra is an excellent option if you require relief from erectile dysfunction for a single night. For instance, if you need to improve your sexual confidence after a date, using Viagra or generic sildenafil will allow you to enjoy yourself without worrying about erectile dysfunction, ED. Before determining which ED medicine is ideal for you based on the length of time it's active in your body, it's advisable to consult with your healthcare professional, since the demands of different individuals might vary significantly. It is also vital to remember that the duration of Cialis and Viagra is not always precisely 36 or 4 hours per dose. Depending on factors such as your body weight, eating habits, and specific medical problems, the effects of either medicine may diminish sooner or later. In general, however, Cialis has a longer duration and is a better choice for weekends that may contain many sexual encounters, whereas Viagra is often a better option for treating sexual dysfunction such as erectile dysfunction for a single evening. Which medication is more rapid? Cialis and Viagra are both fast-acting drugs that should increase erections and sexual performance within an hour. On average, Cialis takes roughly 30 minutes to begin functioning. In some situations, you may not experience the full benefits of Cialis on your erections and general sexual performance until 1 to 2 hours after taking the drug. Similar to Cialis, Viagra normally begins to act within 30 minutes. However, it may take up to an hour for the full effects to manifest. Regardless of whether you take Cialis or Viagra, there are a few basic steps you can take to ensure that your medicine works in time for you to engage in sexual activity. Take your prescription approximately 1 hour before engaging in sexual activity. In this manner, the medicine will be fully or almost fully active by the time you and your partner engage in sexual activity. Notate the amount of time that passes before you feel the effects of your prescription. You may find that it takes a certain length of time before your erections begin to improve. This information can help you tailor your future ED drug use. Avoid eating excessively before using ED medications. Some drugs for erectile dysfunction, such as Viagra, may take longer to act if taken after a substantial meal. The effects of high-fat meals on ED medication are described in further detail below. Which medication, Cialis or Viagra, is more effective? Cialis and Viagra are both extremely effective erectile dysfunction therapies. Both drugs have undergone extensive, large-scale clinical trials as part of the FDA approval process, with data demonstrating that both are effective at enhancing erections. In an article published in the journal Clinical Interventions in Aging, for instance, specialists evaluated the existing efficacy data for tadalafil, the active component in Cialis, to determine its efficacy as an erectile dysfunction therapy. They discovered that 88% of men with erectile dysfunction who used Cialis had effective erections, compared to 64% of men who received a non-therapeutic placebo. They also discovered that males who used Cialis reported higher levels of sexual satisfaction and more successful sexual attempts. A meta-analysis of clinical trial data for sildenafil, the main component in Viagra, indicated that it was an effective medication for enhancing erectile function in males with erectile dysfunction, ED. According to a meta-analysis published in the journal BMC Urology, 82% of men with erectile dysfunction reported better erections after taking 100 milligrams of sildenafil prior to sexual activity. Men who used sildenafil were better able to engage in penetrating intercourse with their partners, suggesting that sildenafil increased sexual satisfaction. When it comes to medicine, it's tempting to become fixated with numbers and believe that the alternative that shows improvement in a little bigger proportion of men must be superior. In actuality, Cialis and Viagra are both incredibly effective therapies for erectile dysfunction, and the little variations in efficacy demonstrated by certain studies are only that small. Cialis and Viagra are both fantastic alternatives if you have erectile dysfunction and want a medicine that will increase blood flow and give you consistent, long-lasting erections. Cialis versus Viagra. Which is the safer medication? Both Cialis and Viagra have exemplary safety profiles. However, like other prescription medications, they may interact with other pharmaceuticals, vitamins, and recreational substances. Cialis, Viagra, and other PDE5 inhibitors can be dangerous when used with certain drugs for high blood pressure, heart failure, and some types of heart surgery. When Cialis, Viagra, and similar drugs are used with nitrites or nitrates, a dramatic decrease in blood pressure may occur. This drop in blood pressure may result in dizziness, fainting, and in extreme situations, life-threatening complications. Other cardiovascular drugs that may interfere with Cialis, Viagra, and comparable erectile dysfunction treatments include alpha blockers and other antihypertensives. Certain recreational substances, such as poppers, might also interact negatively with Cialis, Viagra, and other ED treatments. These medications frequently include amyl nitrate and/or butyl nitrate. Certain drugs may raise or reduce the overall quantity of active Cialis or Viagra in the body at any given time. This may increase your risk of adverse effects or decrease the efficacy of your treatment for erectile dysfunction. Before using Cialis or Viagra, you should inform your healthcare practitioner about any medicines, herbal supplements, and recreational substances you are presently consuming or have previously taken to lower your chance of developing drug interactions. In addition to being aware of potential medication interactions, it is vital to take the following precautions when using Cialis or Viagra. Reduce your alcohol consumption. Although it is permissible to have a modest quantity of alcohol with ED drugs, it is not advised to consume large quantities of alcohol with Viagra or Cialis. On the days you intend to use ED medication, try to reduce your alcohol intake. Certain grapefruit-containing products may interact with Viagra and Cialis. Although this combination has not been explored extensively, evidence shows that grapefruit juice may enhance Cialis or Viagra exposure owing to its effects on certain liver enzymes. Before using any ED drug, if you have heart problems or an irregular heartbeat, see your healthcare professional. If you have an existing heart issue, you may need to take additional care when using Cialis or Viagra. Cialis and Viagra are both safe and effective medications. Before using either medication to treat erectile dysfunction, you must consult your healthcare practitioner about your ED symptoms and overall health, as is the case with any prescription drugs. Viagra or Cialis, which is better? There is no best medication for the treatment of erectile dysfunction. Cialis and Viagra have extremely similar effects, yet each medicine has distinct benefits. If you require a weekend erectile dysfunction medicine that lasts a long time and allows you to have sex whenever you want without planning ahead, Cialis is likely the better option for you. If you prefer an erectile dysfunction medication with a shorter duration of action that allows you to have sex for a single evening without lingering in your system, you will likely prefer the short duration of action and ease of Viagra. Although Cialis and Viagra are the most well-known erectile dysfunction (ED) drugs, they are not the only accessible alternatives. Other ED drugs include Levitra registered, including vardenafil, and Stendra registered, a newer generation ED medication with a quicker onset of action and fewer adverse effects. That is it for today's video. I hope you were able to learn a thing or two about which one is better, Viagra or Cialis. We will see you in the next video. Thank you for watching.